Good evening and welcome to the Digital Excellence Pharma Academy, a joint initiative of CredoWeb and Medicine Man to upskill Indian pharma sales and marketing professionals in their digital adoption journey. This is the 53rd episode in our series of webinars and question answer session with Indian pharma leaders from MNCs and domestic companies, both in India and across the world. All these episodes, webinars, and question answer sessions are available for you to view at any time once you register on www.credoweb.in. So do tell your pharma friends that all these resources are available for your learning free of cost thanks to CreditWeb. And if at any point of your learning journey you want to do a test or a pilot in digital marketing, do get in touch with us and we will be very happy to help you along your digital adoption journey. So that's a very interesting quote by Peter Drucker, one of my favorite, and I'm sure your favorite management thinker, that in the greatest danger in times of turbulence is not the turbulence itself, but our preponderance to deal with the turbulence with the old mindset. So COVID is in many ways redefining the pharma business. So we can say before COVID model and after COVID model. What COVID does is that it challenges us to keep navigating while parts of our old normal sensory data are blocked out. It's very difficult to make the transition very quickly because we are so used to our normal routine. As I say, our habits are very, very strong predictors of our behavior and they are not easy to change. So, on one hand, we have our old habits, and on the other hand, we have the new normal, which has brought in a lot of constraints on our old way of doing our work. And the challenge is how quickly we are willing to adapt to the new changes. There's a lot of studies that show that it takes various number of days to bring about a change in our behavior. And on an average, it says 60 days, 66 days to change your behavior. And what would have otherwise taken 5 years, the work from home or the WFM model, which is now being widely used even by sales professionals, has been accelerated because of the COVID-19 crisis. So, what does it fundamentally require? It requires a new mindset. And this is a topic I have spoken of in the earlier session, so it's available to you for viewing at any point of time. I'm sure that there are many youngsters who have not seen this machine, which in my days we used to call as a typewriter, the principal tool that we used to use for our communication needs. So type down the letters with your fingers, just like you're using the current keyboard, and there's a paper there and a ribbon with full of ink, and that's how we used to do business till the early 90s even, till the computers took over. So many of the changes that are happening, they happen slowly. We are not able to perceive them as dramatic changes because the adoption is very slow. But what has made the digital adoption a necessity is the COVID crisis has brought the normal activities to a standstill. We're all still wondering when is this going to end, while there really seems to be no definite answers. Let's hope a vaccine comes along, but till it comes along, let's adopt what is available to us, especially adopt the new digital mindset. I'm sure that many of you who are watching this are familiar with this board that used to hang around on the doctor's clinic on the entrance to his door. Keep calm. The doctor will see you soon. And Hanno Wolfram, in his wonderful session on key account management and the necessity for adapting key account management, very clearly said that this model which pharma is using is already 40 years old. And that's one reason we need to adapt something new. I'm sure there is nothing, no gadget in your house that is 40 years old, and we all change how we do things and the gadgets that we use and the technologies that we use. So it's about time that we pivoted and take advantage of the COVID crisis to learn a new way of doing business. So this is the emerging model. Of course, this is a survey from the West done by Across Health, which shows that 36% of the specialists and 47% of the GPs did not want to see pharma reps. Some doctors are still grappling with COVID-19 crisis because they are unable to see their patients as they used to see earlier. They are adopting telemedicine to a great extent, but then there are so many challenges in treating patients. But a good number of them have a lot of time on their hands. And this is reflected by a German doctor website, which had a doubling of its traffic from doctors. So things are changing and they will keep changing. So the challenge really is pharma driving against the traffic? With customers headed in one direction and pharma's reliance on traditional marketing means they are driving in the wrong way down a one-way street. If pharma is to continue to improve care through effective delivery of relevant information, it needs to understand which way the traffic is moving. So even though we see the use of digital platforms in various ways, many pharma companies persist increasingly with outdated models of communication, which they were always using, even though doctors, on the other hand, are increasingly using the new models of communication because their livelihood depends on that. Unless they're able to treat patients, not only will they not be able to bring relief to patients, they will not be able to keep their practice going. So they are moving in one direction, and pharma needs to understand which direction they are moving and adapt that changes in the marketplace. Thankfully, though, some things don't change. Successful and sustainable business, which is brand building, is all about finding the right customers, winning the right customers, and keeping the right customers. So it's all about customers, customers, customers. We have seen during the COVID crisis that those companies which had focused on building brands did not really take such a big hit during the COVID crisis. Whether it was a big company like Novo Nordisk, whose Mixtard continued to be one of the top selling molecules, or whether it was a smaller company like Apex Laboratories, which had very well established its Zincovit brand, and everybody suddenly saw the advantage of taking zinc regularly, and they were also able to sustain their business through their brand building exercise. So it's very important to understand that we need to find the right customers, we need to win them, and finally, we need to keep them. And that's the only way of building brands. So, if you will ask any salesperson what are the three top challenges in selling, their answer will be about the same. It is about finding the right customers, winning the right customers, and keeping the right customers. Often, sales and marketing tend to think that they are separate functions, but they are not two separate functions, but two parts of the same function, that is, caring for the customer. So, what is that? It is still finding the right customer. But once you find the right customers, creating the right kind of customer engagement becomes an effort which involves the inputs, the strategies, and the plans of both these marketing teams and the sales teams. And finally, in order to keep them, you have to give the customers the right kind of experience. So you will look at this and realize that it's not just the sales teams that have to reinvent themselves, it is also the marketing teams that need to completely revamp their strategy of looking at customers who is now not freely accessible through the face-to-face model, but however is accessible through the digital channels. So what kind of a marketing strategy do we need, and how do we enable the field force to execute them? So I'll quickly tell you the story of Sisyphus. It is a Greek mythology story. It is a story of the king of Corinth who became infamous for cheating death twice. However, the gods did not like it, and Zeus, sort of put a curse on him that he would forever be rolling up a boulder up the hill. And as soon as he reached the hill and started walking back, the boulder would roll down all over again. And he had to continue to do this exercise of rolling up the boulder up the hill. And then, as he reached up the hill and walked backwards, it rolled down. And he would keep repeating this exercise for all the years that he had cheated death. So often, when we look at the field force, their task is something monotonous and routine because pharma's marketing strategies have not evolved, have not changed in finding the right customers, in winning the right customers, in keeping the right customers by adapting newer ways of engaging customers and creating great customer experiences that keep them loyal to the brand. So the question before us is that how can field force tasks be made more meaningful and effective? Otherwise, they will end up like Sisyphus. The answer is that marketing has to come out with a new strategy. Not just a digital strategy, as Salil Kalyanpur likes to emphasize, and I would encourage you to listen to his webinars and question answer session where he very clearly says that what pharma needs is not a digital strategy, but a clearly thought out marketing strategy which addresses the challenges that customers are facing today. So we have often seen that pharma reacts to these challenges and sort of ends up with an exercise which we can call as paper on glass, kind of a digital exercise, doing the webinars in the same way or using WhatsApp and telephone calls to connect with the doctors at times when they are not interested in engaging with pharma and probably getting a pushback. And this is really not going to work out in the future. So some more very interesting thoughts from Peter Drucker, who emphasizes the importance of marketing strategy. The real importance of marketing strategy is that it is so well thought out, keeping the customer's pain points in mind and communicates so clearly that when the salesperson actually meets the doctor, whether face to face or through the digital channels, it becomes a seamless exercise. So it is a primary responsibility of the marketing department to create customer engagement and experience. The field force is only involved in executing those strategies with individual doctors. And with the digital platforms, they can actually personalize the engagement and experience part based on the customer personas. So the challenge is that you have to answer these 4 questions. How well do you really know your customers? What data do you have about your customers? And what insights into customer preferences can you extract from this data? And how will you personalize your communication using the three C's? So we'll come to that three C's in a while. And this was brought out very clearly by Satya Mahesh in his beautiful blockbuster of a session, where he said that we thought we knew the customers, but when we really dug into the inputs that we had, the data that we had, it was insufficient, often incorrect. So I think both the sales and the marketing teams really have to get to know their customers, their personas, their preferences, so that you can engage with them and create better experiences for them. This is a beautiful example from the Tata ACE case study. Good marketing is no accident. Good marketing has to be thought through by understanding the market, by understanding the customers, and then positioning your product in such a way that it becomes very easy for the sales to happen. If you look at the automobile sector, it's the marketing, it's the positioning by the marketing that really drives the sales to the dealerships. So finding the right customers. What's so tough about finding the right customers? You might have the best product in the world, but until you find enough customers, it's not actually a business. And listening to your customers can also help you to improve your offering from something that people kind of like to something they really love, like the brands. So it's very important for you to really listen to your customers. And what digital and social media does is that it really gives you an insight into what customers think about your communication channels. So that is what we saw when a spate of webinars were pushed out to doctors, when field force people tried to meet doctors. Doctors in their frustration did a lot of posting on social media, conveying their displeasure at what was happening in the marketplace. So we really need to use the social media to listen to doctors. And Twitter is a great place. If you have Facebook connections, LinkedIn connections with the doctors, that will be even more effective for you to spend time listening to the customers. I used to tell in my training sessions before the COVID crisis, the real 80-20, which we all talk about, is about field work. And what I mean by that is that a field person spends 80% of his time waiting and only 20% of his time in actual in-clinic interaction. So if the 20% has to be effective, then the 80% of the time that he spends when he's waiting outside the clinic is very important, because how he spends that time preparing for that 20% of the time will determine the call outcomes. So too, while adopting digital platforms, it is very essential to do social listening. You have to understand your customers. Where is your customer? What is he looking for? What is he Googling for? What are the websites that he visits? What are the kind of patients that he is seeing? And what are the needs of his patients? What are his pain points? And you can see this all in the regular posts. If you're spending some time following the right kind of people, you will be able to find the right customers for your company. And what about winning the right customers? It's not enough to kind of sort of know your customers. Pharma must know their customers up and down and all around. They need a crystal clear understanding of the customer pain points and journey. Salil Kalyarpur has taken 2 sessions on customer journey. So, all these resources are available to you. So please visit the website and view this at your convenience so that you improve your understanding and therefore are able to develop a more cohesive and more relevant marketing strategy that is relevant to our times and our situation. And finally, keeping the right customers. When you intimately know customer personas and communicate to them in a personal way, you skyrocket your chances of turning them from just a contact to a lifelong customer. Often that's what happens is that the customer remains just a contact in the master doctor list or MSLs, that or whatever you want to call those databases that each representative has. Often the name of the doctor and a few little information remains just a data point in the database rather than a real persona of the doctor. Who is he? What does he like? What does he dislike? So those are the things that pharma needs to understand so that you can empathize with his pain points. So when you empathize with his pain points, then it is easier to come out with the right solutions to create the right engagement and the right experience for each one of them. I'm sure that this is the experience of most field people, that they wonder why different doctors respond differently. So once you understand this, then you will be able to do some personalization. So you have a list of 150 doctors, and of how many doctors have you been able to create a comprehensive database or data points that captures informations as is shown in the slide, so that ultimately you know what are his goals and what are his challenges, and therefore you can create the engagement that is based on his goals and the experiences that address his challenges. So it's very important for you to understand your customers. If you look at many of the pop and mom stores, the grocery stores, they are still thriving, especially in the COVID season, because they understand their customer needs very well. And because they are able to understand their customer need very well, they're able to create an experience for their customers which make them to come back to these stores, even though it's often very convenient to order it online. So, who are your customers? Are they youngsters? Are they digital natives? Or are they digital natives? So, you need to have a clear understanding of your customers. What do they want to accomplish? And that determines the buying process. I always say that pharma focuses on the selling process, but it should also understand the buying process, which is understanding the customer's perspective. And the buying process starts before the selling process starts. And the selling process has to match the buying process. The moment a doctor finishes his MBBS or MD or MDDM and sets up practice or begins to work in the hospital and starts seeing patient, the buying process has begun. He has a need to prescribe certain products to the patients that he is seeing every day. And therefore, you need to have an understanding of his persona and the needs and challenges of his patients to be able to engage him effectively. Moreover, you have to understand that nothing appeals to everybody, which is why we need to segment the market. They exist already, and we only have to discover them and put them in the right slots. So I'm sure that all of you are familiar with the basics of segmentation. Geographic segmentation is based on primarily on the metros and urban and rural areas, and within the territory itself. I'm sure that based on your company's strategy, you are able to identify whether you should see doctors in the low income areas, in the middle income areas, or in the high income areas, so that you are selecting the right doctors. Because if you select the right doctors, then it is easier to win them. If you win them, then it's easier to keep them. The demographic is nothing but, as I showed in the earlier slide, it's all about the information about the customers. What's his professional role? What's his education? What is his relationship status? Where does he live? And what's his background, which kind of institution did he study, what are his routines, his practice timings, how many clinics does he go to, how many hospitals does he visit, what are his interests, his hobbies. These are very important to Engage customers because, like any of us, they have their likes and hobbies, which often become a good place to connect with them. And then, of course, their challenges. So it's very important to understand your customers, who they are, and what they want to accomplish if you want to segment them in the right way so that you have the right set of customers for your marketing communication. So this is a very, very famous theory, Rogers curve of innovation adoption, and I have just adapted it to the digital adoption. So what it simply says is that in any given market, a very small segment of people, 2.5%, are considered as innovators. Pharma generally thinks of them as key opinion leaders, and these are the people with whom pharma tries to start clinical trials, the initial launch of the products, because they are more open to experimenting. And then there are the early adopters, a good 13.5%. So if you know this segment, then it is easier for you to launch your digital strategy. So knowing your customer means knowing their mindset. And then a large segment are the early majority, an equally large late majority, and there's a good 16%, like the innovators and early adopters, there's a good 16% who are laggards, and they all have different learning styles. So it's important to understand their learning styles in order to be able to engage them and create their good experiences for them. So in the digital world, I would call them, instead of KOLs, I would call them digital opinion leaders or DOLs, and they are experimenters. They are open to new experiences. And if you look at the early adopters, they like to connect and learn from the digital opinion leaders. So it's so important to understand how the digital networks work, who follows whom in the digital space. And today there are literally lakhs of doctors on the social media, and I follow a couple of thousand of them on Twitter, and it's a hugely rewarding learning experiences as they share their opinions, especially about the COVID crisis and so many of their interest areas, their hobbies and other things. It's wonderful to connect with these doctors. So these doctors want to connect with the opinion leaders online and learn from them and benefit from their network. Then the early majority, they are very well suited for your webinar invitations and your virtual conferences if you are digitally beaming them out. But if you invite the innovators through webinars, not such a good idea unless you're inviting them as a faculty or as a speaker. So it's very important to understand the digital status of your customers. Then there are the late majorities who follow the leaders through trends on social media, including Facebook. Then there are the laggards. I say that they are very apprehensively watching the trends that are shaping up, and they're very comfortable with channels like WhatsApp and WhatsApp groups, which are closed so that they feel safe within them. And of course, in addition to this, there are so many other avenues available for doctors, like the peer-to-peer learning groups. You have Curify, you have DocPlexus, and these are platforms that are close to doctors, and so they can express their opinions freely, unlike in social media. So you need to identify, understand, and apply these to create the right engagement and create the right experience. Remember, at the end of the day, the doctor is not a digital entity, but the doctor is a person who has his emotions. Now, some of them control their emotions and they don't show them. We can call them the methodical types and the competitive types. And there are others who display their emotions. We can call them as spontaneous and humanistic. So it's very important for you to understand which type of doctors ask a lot of questions and which type of doctors tell you a lot of things so that you have to listen to them. So you should be able to, I'm sure that your relationship and rapport with customers over this period of time has taught you which of the doctors are the ones who ask a lot of questions. Sometimes you're not able to answer them. And which of the doctors tell you a lot of things about your drugs and about their challenges. So these are a brief description of the different types. The methodical doctors, they want to be fully organized, and they take a long while to make a decision. So if you are going to adapt a digital strategy for these people, it needs to be well thought out and it has to be systematic, because they take a long while before they decide to prescribe your product. And then there is the competitive person. They're very competitive, they're very competent, and they seek competence in others. So if you are not well organized, if you are sloppy, they will not appreciate it. And just like in the face-to-face interactions, the doctor may not give you much time. In the digital world, it is even more easier. Just a click of the mouse, and your communication has gone for a toss. And then there are the humanistic persons. They are full of life. They enjoy helping others, and reps in the face-to-face world enjoy meeting these doctors because they're very cordial, they express their emotions. And then there is the spontaneous type of doctors, and then they are again very friendly people, and they are usually quick to reach a decision. So your sales cycle should be adapted to the persona of the doctors, not some arbitrary number on your calendar of 90 days or whatever. It should learn about the customer, his preferences, and then your sales cycle should be built around or personalized to meet the needs of individual customers. And this is all about how doctors look at pharma companies. It is the rise of independence versus the transactionals or the knowledge seekers or even the relationship seekers. So there is a tremendous shift or a churn going on in the pharmaceutical marketing, because there is a better understanding, at least in the Western world, of the doctor's personas. And we in the Indian market have to catch up with this understanding so that we can use the digital media effectively to engage with these doctors and create a better experience for them. In simple terms, as I said in my earlier session, different cash for different personalities. Cash stands for knowledge, attitude, skills, and habits. And the session is once again available to you for viewing at any time you wish to do so. So then the question comes is that we have said that business is all about customers, 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 finding the right customers, winning the right customers, keeping the right customers. So are doctors pharma's only customers? That is the traditional belief, but let us look at this again. Patients. Ultimately, your business is sustainable if the patient is compliant, or what we say as adheres to the treatment. Because if you look at the modern trend, there is an increase in lifestyle diseases like cardiovascular and diabetes. And this has been repeatedly shown by the rising sales of cardiology products and diabetes products. So the top 10 category, you will find mostly products in these two categories. So once a person is diagnosed either with high blood pressure or with diabetes, it's a lifelong treatment. But most of them do not adhere to the treatment, and therefore you are not able to build a strong brand. And that's why you need to look afresh at the customer pyramid and keep patients at the top. And what's the best way to understand patients? There are a lot of patient advocacy groups. Take their support. We have featured Aparna Mittal, who's the CEO of Patients Engage, just 2 weeks back. So listen to her about what she has to say, how moderated patient forums are the right place to connect with patients, to understand their challenges, to create patient-to-patient support groups, which are very effective for patients to understand their indications and better manage them. Then the healthcare media, often neglected area by especially Indian pharma. although in the West it is becoming very common to use the healthcare media. And that is why I use the term digital opinion leaders, because when they appear on healthcare media, it makes a lot of impact on the society and the people listening to this media. I'm sure that you would have seen people like Dr. Devi Prasad Shetty or Dr. Naresh Trehan speaking on television on various topics, including COVID. So these carry a lot of influence that has an impact on digital key opinion leaders. So you need to understand how you can look at them as part of the stakeholder network. Then there are the retail chains. It's not just the standalone chemist shops that we are used to, but you have the retail chains, and now even big players like Amazon and Apollo and even Geo, Reliance is coming into the retail chain. So they require a completely different set of skills to win them, and that is what Hanno Wolfram talks in his session as key account management, a completely different set of skills that are required. And then there are retail pharmacies. Perhaps they will require specialized sales forces who understand the distribution and the supply chain much better and are able to maximize the efforts that they put in so that they translate into tangible results. Even Satya Mahesh talked about this in his last webinars, that going forward, he says that we can see two kinds of reps. One is the medical science liaison, or MSLs as they're called, who are supported by the regional medical advisors, and they focus only on the knowledge part of the doctor's information needs. And then the traditional sales rep or the medical rep who focuses on the sales function. Very rarely we look at distributors as our customers. We look at that something as we own our distributor and their field force. The boys who go out to meet the chemist, we give them even less attention. This has to change, and we have to have a robust relationship management with the distributors and their field force, because they act like kind of a force multiplier for your sales efforts. And you would have seen that during the lockdown period, it is because the retailers worked so effectively in challenging situations, and those companies that manage their distributors very well, as Atish Majumdar talked about in his session, how they gave 1% additional incentives to the distributors because they understood the challenge of the distributors in these times, and they were able to have a robust relationship with them. And that is what we have to learn from all these sessions that are already available to you. And finally, of course, all of us are familiar: doctors, hospitals, and perhaps look more at governments now, now that COVID has made it so abundant that public healthcare is very important. And as vaccines come in and so many of the new treatments for COVID come in, government and NGOs will probably play an increasing role. So as far as doctors and hospitals are concerned, maybe hybrid models can be the answer going forwards. I always say that to get the right customers, find the right customers, to win the right customers, and keep the right customers, there are only three ways to get ethical prescription. Number one, you have to increase the number of leads. That means you have to tap into a larger number of doctors and then take them through the process of prospecting till they become your customer. And if they prescribe more than one product, they become your clients. We will look at that later. And the second way is to shorten the sales cycle. Here, I'm not talking about your monthly cycle or your 45-day cycle. What I'm referring to is that how many calls or visits, and now in the digital times, we have to say how many touch points and what kind of channels can you use before the doctor begins to respond to your approach and prescribes your product. And then finally, how can you personalize the sales process? That's what we've been talking all about: understanding the doctor's personas and their pain points and their challenges so that we can personalize the sales process, ultimately leading to more prescriptions in an ethical way. How do we find the right customers? We have to use the sales funnel. So I always say that in a given territory, all the 100 doctors, you can say that they are suspects. But as you apply a certain filtering parameter based on a company's portfolio, therapy areas, and the goals and objectives, you will eliminate quite a bit of them. And I'm just giving this 50% for illustration purpose. And you will arrive at a good number of people who you will treat as prospects. And then finally, you have 25%, that's again an illustrative figure of customers. What's the difference between prospects and customers? A customer is somebody who has used your product at least once. And then as you build your relationship with the customers, many of them will become regular prescribers, not just when you meet them face to face or through digital touch points, which are essential, but they keep prescribing your products. So again, a few number of doctors, you can call them as your clients. And finally, you will have a good number of doctors, perhaps 5%. This is again illustrative percentage who will prescribe more than one of your products. So this is very essential if you're operating in a particular therapy area and you're seeing a fixed number of doctors, and then you need doctors who will use two or three of your products on a regular basis, and such doctors we call as partners. And finally, a very small percent will become advocates or KOLs. So this is the sales funnel. You apply a filtering process for all the doctors that is in a particular territory, and then you have prospects. You do a retail chemist prescription audit, and this may not be so easy to do now, but using the digital channels, it's much easier to understand the prescription patterns of doctors, because more and more e-pharmacies and so many digital platforms are coming. A digital writing pad which captures what doctors are actually prescribing, and all this information will be available, so you can do a digital RCPA on the prospects, and finally focus on some of them to make them use your products and become customers. And once they become customers, I will say that you have a good customer relationship management system, not the one which is currently being used, but the one which Deep Bhandari talks about, in which you become a trusted advisor. So that's one more module by Deep Bhandari I would highly recommend that you watch to understand what really is customer relationship management. And then as you adopt this CRM, they become your clients and regular prescribers, and then you have to increase the level of engagement with them. And that is what engagement and experience is all about, which makes them partners. And then you employ key account management, because they're very important segment of doctors for your company's business, and they also look at your organization as important to their practice. And then finally, the key opinion leaders, you'll need an altogether different mechanism of KOL relationship management. So coming back again to the challenges of our field force people, this is by Zig Ziglar, one of the very famous writers about motivation and selling skills. He says that every sale has 5 obstacles. What are those 5 obstacles? The number one is no need. I don't need it. I'm satisfied with whatever I have. And the second one, they may say it's too expensive. I can't afford it, or my patients can't afford it. And the third category is they may say, I'm in no hurry because the current treatment is working very well. I just don't try anything new. These could be the late majority, as I talked about in the segmentation, or even the laggards. So you need to know your customers well before you can find the right customers. And then some of them have no desire to change. They say it's going fine. So there's no desire to learn something new and change. And then trust is very important, because you have a very high level of attrition in the field today. Here today and gone tomorrow is not the way to build trust. So not having trust is also a major issue and an obstacle in the way of every sale. So when there is no need, what do? You create awareness. And that is why it is so important to adapt the digital, because it is much easier to create awareness or even a mass awareness through the digital mediums. No money, you have to do the prospecting. You have to find the right kind of customers. As I said, in a territory, there may be doctors who are practicing in a low income group area, in a middle income group area, and a higher income group area. So you need to do the prospecting to find what is the profile of the doctor, where does he practice, what kind of patients does he see, does he see daily laborers or does he see software engineers? So that will help you to fine tune your customer list. So there are doctors who say no hurry. So look at the early adopters, look at the innovators, look at the early majority and target them for your communications. And probably you will have better results over there. There's no desire. You have to find a way to generate interest by knowing their pain points, by knowing their goals, by knowing their challenges, and customizing your communication to address those needs and challenges. And if there is no trust, then you have to establish credibility, primarily through regular touch points with the doctor, putting out the information that is accurate and not product centric, but customer centric and patient centric. So there are so many things that you can do, as I said, about MSLs and other ways which help you to establish the credibility and build trust with the doctors. So I will briefly touch about my favorite sales process, AIDA, which stands for awareness, interest, desire, and action. And I think that it still is relevant in the modern days because unless the doctor is aware about your product, he cannot prescribe your product. So it's very important to create awareness. And I said that digital channels are very, very useful in creating awareness about either a new indication for your product or new product launch. It's very effective in doing that. And then next step, will your product meet his need? That's why I said personas, understanding the customer thoroughly is very important to know whether your product meets the need of the doctor so that you can create interest. And then is your product a better alternative compared to what he's currently using? How can you position it as a better alternative? How can you communicate it based on his persona and his needs? And then finally, the action steps to get the first prescription. And this is an ongoing activity that you keep on doing to maintain the relationship with the doctors and their level of engagement with your organization and doing the different levels of customer relationship management based on which stage they are with you, using the sales funnel regularly, as well as understanding the sales cycle and making it much more sharper. So I'm coming to the end of the session. Customer rapport and relationship is based on finding the right doctor and giving him the right content in the right context. What is the context of the information? How did you know that this is the content that he would be interested in? Do some social listening and find out his needs, his pain points, his challenges, his goals. And that should set the context. And then finally, what are the channels he prefers? If it's a face to face or a combination or a hybrid. So these are the three C's that I talked about in the earlier slides: the right content, the right context, and the right channels. And this leads to rapport and relationship, which can enable you to have a better engagement and better experience for the customer, leading to winning the customers and keeping the customers. So I hope that this has been useful to you to make the field force task more meaningful. So Indian pharma marketing professionals will really have to dig deep into building a more robust marketing strategy that makes the job of the field force people more effective. But if they have this approach, then I put out this cartoon just yesterday, and it's been going viral on the social media. Everybody wants to adopt digital, but they say we want to do something unique that nobody has done. But then when the brand managers or the agency gives them certain ideas, they say, it sounds risky. Can you give us examples or case studies? Well, if somebody has already done it, that means it's not innovative anymore. So that's why you need to understand that you need to do a small pilot, understand from that, see what works, see what doesn't work, and then it's a steep learning curve. And that is where our partner CredoWeb will be able to help you on your digital adoption journey. So list your learning from this session and discuss with your colleagues how you will apply it, and do share it with your pharma friends, because when we all learn together, then we will be able to bring about a digital transformation of the Indian pharma industry. So thank you for listening in. Have a great evening. Thank you.